All right, let's now discuss our final topics for this particular chapter. In particular, identify or describe other accounting issues in the healthcare industry, including legislation, auditing, taxation, and regulation, prepaid healthcare services, and CCRCs or continuing care retirement communities. Also, discuss financial and operational analyses of healthcare organizations. So, in regards to these topics, one thing that we need to be concerned with when it comes to our healthcare organizations is when they have related entities. There is financial reporting guidance available related to when there are consolidations that have taken place. There are also guidance and standards in regards to affiliations. If the organization happens to be a for-profit or a non-governmental, not-for-profit, then the accountants and management would be seeking information through what's available at FASB. And then if it's a governmental entity, of course, they're going to go with the GASB information. Just like with what you guys have learned in the intermediate courses, when we're talking about control of an organization, it is still applicable even to a not-for-profit. So how does one organization happen to control another one? Due to lots of things going on in the healthcare industry, especially when it comes to these laws being passed by Congress, and things having to be met with the IRS for the not-for-profit folks, there have been quite a few mergers and acquisitions and consolidations due to all of these changes and all the fun they get to have regarding regulatory compliance, etc. So think when you're putting together the financial statements of an entity, always think of all of the different users who look at this information. So consider all the parties. It's not just management, it's not just the IRS. If it happens to be a for-profit entity, who are the actual owners? What about the creditors of the organization? Who are the regulators? Are there any licensing issues, etc.? So there's a lot of information that we need to be reporting, and that even includes relationships that we have with other entities. In regards to auditing, the text goes into the fact that those who audit, whether they're internal auditors or external auditors of the organization, they've got a lot of things to be concerned with. Not only are we, of course, concerned with our regular accounting things like contingencies and how are other items showing up on the balance sheet, but of course they've got to be concerned with issues with those third-party payers. What are those contracts between the entity and the third-party payers? Because there's a lot of information included in these contracts, and of course how things are supposed to be paid for, billed, etc., all are going to tie back into the accounts receivables and our balances as far as what those differences are that maybe we don't expect to get paid. And also think of what we said about the related entities. That information needs to be tied in, especially if there is control there. Again, with all of these laws and compliance issues coming into play, some organizations have struggled with the compliance to them, and I'll talk more about that here in a moment. But some organizations suffered greatly, especially during the economic downturn. Even the healthcare industry was affected by that. If you read the paper or pay attention to the news, we've even had entities here locally who have had to restructure. So if there's restructuring, that comes into play. Auditors also need to be concerned with things such as illegal acts and fraud. Now, Congress has passed several different laws. We know about HIPAA, but there's also the False Claims Act and the Stark laws. And then we also know about the Patient Protection and ACA, or Affordable Care Act. These all have things tied into them in regards to issues that have been suffered in the past, improper billing and coding, improper care, and kickbacks, and Congress is doing their best to try to eliminate these basically criminal acts. In regards to fraud, I want you guys to know that for sure fraud is absolutely everywhere. Maybe at a later date I'll see you guys in my forensic accounting and fraud examination class, but even the healthcare industry suffers from fraud. At some of our insurance carriers in town, Blue Cross Blue Shield for certain, they literally have special investigative units that do nothing but focus on healthcare fraud. It is estimated that between 6.7 and 10% is lost to healthcare fraud. It's very sad. So even auditors have to be concerned with fraud, because what if they're auditing a healthcare entity of some sort and there is fraud there? There's plenty of stories out there about facilities, even doctors, overbilling Medicare and Medicaid in regards to bundling and coding and all that stuff. So auditors have a lot to be concerned with. Moving on, in regards to taxation and regulatory issues, not only do these not-for-profit healthcare entities have to be concerned with the IRS's 501c3. Again, we talked about that earlier. We've got that tax-exempt status. The entity applied for it. They listed their goals and intentions, and we know that there's some charity care involved there in order to be able to receive that tax exemption status. So the entity is not only concerned with continuing to provide charity care and compliance with the IRS 501c3 items, including such things as UBIT, which we know is that unrelated business income, and the taxes on that. But they also need to be concerned with other items going on within the organization. Now, hopefully you guys have heard about independent contractor status in another class. If not, write it down, look it up. Independent contractor is basically how you review how employees work for you and how you categorize them. And if they are employees, by all means, you better categorize them as employees in regards to benefits, in regards to payments for Social Security and Medicare, and a bunch of other things that are all tied into that. If a 501c3 does not have their people categorized correctly, they could get in some serious trouble. All right, so how we categorize, or what's the employee status? Are they an employee? Are they treated as an independent contractor? Other issues to be concerned with at a healthcare entity is when we have excess economic benefit to individuals with substantial influence. Basically, what we're talking about is private inurement, which is basically, think of C-suite folks overcompensation. All right, so again, if we're overcompensating some folks, that's going to become a problem. The IRS and others are also concerned with physician recruiting incentive pay. So again, hospitals or healthcare entities of some sort will provide a carrot, if you will, to get doctors to come to their facilities. And as we know, we've got this aging population, the baby boomers. You guys are going to see a lot of this stuff coming to fruition. They have got to have the medical staff, the nurses, the doctors, and the facilities in order to handle what we see coming as this generation ages. The book also mentions that Patient Protection and Affordable Care Act has an additional 990 requirement for the not-for-profit 501c3 healthcare entities. Basically, they've got to disclose such things as their financial assistance and also information about their emergency room care. And then, most importantly, every 3 years they have got to conduct and report on a community health needs assessment. And I'm quite certain I've heard about these being disclosed here in Chattanooga. And if we wanted to, I'm sure we could get on the internet and dig around and find one to actually look at. Additionally, in regards to the Patient Protection and Affordable Care Act, that was passed in 2010. Basically, it's all about the health insurance industry, if you will, and Congress's intent was to reform it with the intention of improved quality of health care. However, if you've been paying attention for the last couple of years, both to the news but also to the things being discussed on social media by your friends and family, whether you're looking at it from the individual patient level or looking at it from the healthcare entity level or even folks at the insurance companies, you will hear and see that it's been very burdensome. It's almost like a flashback to when Sarbanes-Oxley was implemented. You've got all kinds of additional record keeping needing to be done, all kinds of additional reporting needing to be done. All right, so this is putting a burden on the doctors, on the hospitals, etc. They've got all kinds of things that they need to track and report on now. So that means they've got to have better systems in place, more accounting information being tracked. So again, we already know this is a complex industry. It just added to what needs to be taken care of. From an individual standpoint, we now have the fact that it's mandatory for everyone to obtain and pay for insurance. That includes the young people who typically in the past didn't need insurance. They're quite healthy, no major problems. They didn't want to have to pay for it, but now they do. There's fines involved with the IRS, etc. So now that we have a lot more people paying into the insurance industry, what we were hoping for was lower insurance rates. Well, insurance is very expensive. So therefore we've got some folks that struggle just to pay their premiums, and then when they do have something happen, they have high deductibles that they have to meet in order for the insurance to kick in and start helping them pay for the medical bills. So while these healthcare entities may see their charity cases going down, now what they're seeing instead is bad debt expense increasing because of the amount of write-offs they're having to make for the people who can't pay because of the insurance. Alright, so their deductibles are so high that they're running a tab with the hospital and then they can't pay it. So it's being written off that way. So before it would have probably been deemed charity, now it's being deemed as bad debt expense. Alright, so again, Patient Protection and Affordable Care Act, complex issue. Next item, prepaid health care plans. These were mentioned earlier as the HMOs and the PPOs, which the HMO stands for Health Maintenance Organizations, and the PPOs stands for Preferred Provider Organizations. And basically those parties serve as the mediator or the broker, if you will. They come up with a plan for the consumer or patients, and they approach the healthcare provider, the healthcare entity, and they come up with an agreement of what's going to be covered and what's going to get paid. These are very complex contracts, And if the healthcare entity signs on for one of these, what they will show is premium revenue, and they'll recognize revenue over the period as the members or the customers or consumers or patients, whatever you want to call them, as they are entitled to services. Okay, so for whatever period of time they're entitled to services by the entity, then the entity is going to recognize the revenues of those premiums over that time, not as the services are actually rendered. Because again, they're paying in, maybe they don't need services during the period. So we're going to recognize the revenues over the period, not as the services may actually be rendered by the healthcare entity. All right, continuing care retirement communities, or CCRCs, we're seeing growth in this area. Just look around, you'll see a few here in our area of town. Many of these are set up as not-for-profits, and basically what it is a residential care type facility with some level of long-term medical care available, but it's not as intense as what is provided in like a hospital setting. So they don't have intensive care, they don't have physical therapy. Some do have physical therapy. They don't have emergency room, etc. at the facility, but they've got basic nursing care. And basically these things are set up with a contract between the individual person who is going to be the resident or the patient and the CCRC. And typically what happens is when the individual signs on, they make an advance payment into the CCRC, like an entrance fee, and then over time they make periodic payments. In regards to that advance fee, when it comes into the CCRC, they need to book it as deferred revenue. The non-refundable portion, what is definitely going to be kept by the organization, whether or not the individual ever moves in, is going to be deferred revenue, and then we amortize it to revenue or income over the future periods. But any portion of that advance fee that is likely to be refunded, in other words, when we look at things like a contingency, what is expected, what is past experience, how much do we most likely are we going to have to refund based on the terms and conditions of the contract, we would need to report that as a refund liability on the balance sheet. Last item in regards to the financial and operational analyses of healthcare organizations. There is a chart within the text that gives you access to several different statistics, and what does the statistic represent to a healthcare entity, and then gives you the calculation. So if you think about it, some of these are quite similar to what we would do for just a regular for-profit entity. I mean, for example, they've got the current ratio here, they've got the debt service coverage ratio, they've got average payment period, and some other ones that are on here that, you know, we've seen these before. But then they have some that seem to be very specific to healthcare. So let's think about it. If we are analyzing a healthcare entity, we are going to have some of the same types of concerns about the entity as we would if it was a for-profit entity. Alright, so we're talking about management, we're talking about the creditors, we may be even reviewing the entity from a merger and acquisition viewpoint. Alright, so we can utilize a variety of ratios. We can take those ratios and we can compare them to the entity's past performance, the historical information that we may have on the entity itself. But of course, we could also incorporate benchmarks. What are the best of the best in our industry, in a specific service area? How are they performing? They're incorporating best practices, and we want to compare ourselves to them, because healthcare entities, just like other entities, need to also be striving for continuous improvement. I have mentioned to you guys in the past that there is definitely a need for using lean in healthcare, and that I've been to a couple of meetings about the fact that we've got lots of organizations here in town seeking to embrace lean within their organization. So I highly recommend, if you're interested in healthcare, look into that. One other thing that I wanted to mention in regards to lean and the fact that you can use things in a healthcare entity and a governmental institution that are also used in industry. In my Principles of Accounting 2 class and also my Advanced Managerial class, I talked to the students about this book called The Goal. Again, that's the Goal, Goal, and I want to say the author's last name is something like Goldrat or Goldblatt, Goldrat or Goldblatt. It's a great book to read if you plan on going into manufacturing, but you could also read it and think about what goes on in a healthcare entity. Great book. All right. One final thing here. In the text, they also have, underneath the key terms, selected references. If I was going to get into healthcare, or I was going to get into governmental, which I plan on doing that at some point, I'm going to hang on to this book, and I'm going to go back and I'm going to look at these selected references, because knowledge is power.